less than a month later, we are all back in the same situation. Do you think that this time around we're a lot better prepared to start scaling back into what a new normal would be or whatever that looks like?
So the question is, we were in a similar situation in the summer of 2021. I distinctly remember we were seeing 1 case a day, and we thought that was incredible, and this was the end of it all. But again, the virus is smart. It can mutate, it can change. And so we saw a new variant. We also saw the fact that we were moving back to indoor settings again. I am optimistic that this time around that we are trending in a very much endemic or coexistence with this virus. And that largely has to do with not only better understanding how the virus itself works. Every day, every hour, we just collect more information, more science around it. But also what we have in our toolbox to fight it has changed. And the amount of tools the volume has changed too. So vaccinations in in July and August, we're still focused on very specific age groups. Now it's anyone 5 and older. Likewise, treatment courses were still limited or had to be done in inpatient or very prescribed settings. Now we're seeing it more on the outpatient side. So the landscape has also changed as well. So I am optimistic this time that we've gotten better equipped, a better understanding of what we're fighting and understanding kind of how it operates, that we would be able to kind of take appropriate steps. Having said that, though, the word is going to be pivot. You will have to recognize that there might be a situation where we will have to, based on data, come back to some mitigations in certain settings or keep on decreasing as well.
And have we seen people still going out and getting the vaccine, or is that starting to kind of taper off a little bit more again?
So our vaccination levels definitely have tapered off in terms of first and second doses, but we are seeing a lot of boosters coming back online. And so, we keep supporting, making sure people are getting their booster vaccine. That's very important. We expect that there's going to be another surge of vaccinations, and hopefully in April when the under 5 population will become eligible. Again, as you know, we were hopeful last time we did this press briefing that we would be able to start offering up vaccinations. But, wanting to make sure that the data was there, as well as getting further understanding of, with Omicron, how it impacts certain ages under 5, that's been now pushed back until April. So we do think that vaccinations will still continue to happen, but I don't know if you're going to see this large rush. In the future, it might be related to boosters again.
Laura, do you think we're going to need more boosters on the 4th shot?
It's too early to tell if we're going to need more boosters on the 4th shot or, what it's going to look like moving forward. And I think just, again, recognizing that the more we understand the virus, the smarter we're able to fight it.
Do you know who will be that will determine that the pandemic is over and now we're now in an endemic? Who determines that?
So the question is, who gets to make that call and put their stamp on, says this pandemic is over, we're moving into endemic phase. I think personally there's a lot of people that wishes that was their call, and they've maybe made the personal decision that they're kind of done with this as well, for a variety of reasons. It's, the terminology we use, pandemic, is a global designation through the World Health Organization, or WHO. And so with that in mind, it's going to be the WHO that really pushes forward that language of whether we are now in a pandemic or an endemic. Along with the Centers for Disease Control and Prevention, or the CDC, will also make that decision nationally where we are at. Having said that, we do have states that are no longer declaring public health emergencies anymore, feeling that they've stepped into that endemic phase. And again, those are just the steps on how you start, downgrading or deaccelerating out of this, and it is going to be a process. Great. Well, we do not have a next scheduled briefing. If for any reason things change, which most likely they do because that's the world we live in, the public information officers will notify all of you if we do have another briefing. Otherwise, take care.